Pandemic COVID-19. This video is not to scare you with the number of corona positive cases or how to maintain social distancing. Definitely I'll talk about it a little, but today my concern is my fellow medical colleagues, paramedics and civil workers of the society. Hello Indians, I'm Dr. Mazia from Pune. I'm also into training of budding medical students. You are well aware of the pandemic COVID-19. Currently, as on 28th of March, the number of corona positive cases in India are 918, and we have seen this escalation from one COVID positive as on 30 January 2020. So if we try to visualize this as a bell-shaped curve, we are on the first half, we are on the rise escalation because the chain of infection has already been built. But hopeful, it is presumably right that we will witness the flattening of this curve after the 18 days lockdown period, provided if used effectively. That is, we maintain a much required social isolation, take very good care of our personal and family hygiene, besides keeping a check on our psychological and physical well-being. The administration has taken a very appropriate call to combat this upheaval of COVID-19. Friends, my much needed and much frightening concern today is my medicos, my colleagues, paramedics, police and civil auxiliary staff, and for a very valid reason. The last minute rush of PPE, that is personal and protective equipments, which includes your gloves, face mask, body covers, head caps and boot covers. WHO in February warned us that we need to increase the manufacturing of protective gears by 40%, which was not heard of, not at least by India. As the record says, we continue to do the exports to other countries rather than stockpiling for our doctors and our workers. As of today, the government estimates that we require 1 crore surgical masks, 60 lakh N95 respirators and 7 lakh body covers immediately within the next 2 months, because these 2 months are the most critical to seize the rising cases of corona. So this requirement of 1 lakh surgical mask or 60 lakh N95 respirators is the requirement only for the doctors and paramedics. I haven't considered the requirement of protective gears by our sanitation workers, police, civil staffs, garbage cleaners and drivers. I haven't considered that mass yet. So this number of 1 crore mask is the requirement for the next 2 months. And to this, the production capacity of a country for the next 1 month is less than 1 lakh. This delta is scary. And if this insufficiency continues, we are going to weaken the spine of the country, that is our doctors, our healthcare system. And definitely the country cannot afford to weaken this backbone right now. The doctors working for the most esteemed institute, AIIMS, for which they would have put fanatical efforts when they were students, are made to work round the clocks with simply handmade masks. I was reading a tweet of a resident doctor yesterday. Within quotes it said, "When they arrive, please send N95 and gloves to my grave." Instead of providing medicos and civil workers and their families with resources and gratitude, we have put them in a situation where they are made to work in general wards with 2-ply masks because there are no 3-ply and N95 respirators available in abundance, or they simply appeal and tweet and go back to the work tirelessly. Because their profession doesn't allow them to step back from work. But now what to do? We cannot just grumble on the situation and let the medicos and other civil workers work in scare and distress. Nor can we just roll our eyes over the government because they may have their own challenges. It is high time that the complete industry, right from big private firms to small and medium enterprises, start manufacturing the protective gears to combat this upheaval. We are big producers of textile. The textile houses such as Vardhaman, Raymond's and Bombay Dyeing and all others should come on a war footing for the production of 3-ply and N95. The paper industry should also step as an auxiliary. The manufacturing cost for a single fact of a 3-ply mask has gone from 250 rupees per kg to 3000. And it is very certain, very clear that this rise is because of a big gap between the demand and supply. My earnest appeal is to all the non-woven fabric makers of the country to tie up with the elastic and thin metal wire suppliers and start and upscale the production of masks and gowns with an immediate urgency. Vinyl is something which is used all across the industry, right from healthcare to construction to automotive and children toys. Every industry using vinyl can set up small manufacturing units to start the production of vinyl gloves, because it is not how big the productivity from one factory should be. The quantity of protective gears will increase when many units, many small factories and large factories are active at this time of crisis. Even a small production unit can be of a big contribution, because the demand is much more what we can think of. Because as this epidemic is rising, as I told you that we are constantly in the escalation of the COVID positive numbers, the demand of protective gears will obviously also increase. For the fact, I'll share a small medical fact with you. A doctor or a nurse who's attending to a suspect of corona, the patient is only a suspect of corona. If a doctor or a nurse is attending to such a patient, he or she requires 6 sets of protective gears per shift. But a doctor or a nurse requires 20 sets of protective gears per shift if the patient to whom he is attending is corona positive. That means the patient is suffering from COVID-19 disease. So, we need a lot of them. And simply 2 or 3 factories that are working right now will not suffice the purpose at all. My appeal is also to the factories using plastic and acrylic to modify their process and start the production of eye shields, eye goggles and face shields. That is your complete face covers, acrylic face covers. Making of sanitizers involves both the chemical disinfectant solution and the bottling units. The food and beverage industry, liquor plants, toiletries plants could share their bottling units with disinfectant solution makers. Because again, we just not need a lot of sanitizer, but we need a big amount of disinfectant liquid also to disinfect our hospital wards, isolation wards, and the solid protective gears, that is your eye goggles and face shields, which can be wiped off. We are already hearing the buzz that automobile industry has started the manufacturing of ventilators. It is high time that the other industries should head out to disrupt this chaos and to settle this insufficiency of protective gears. My appeal is, if you are an entrepreneur, a decision maker in any organization, a worker, a supervisor, a manager at any level, show your concern, contribute your bit, and share this urgency with your team, your boss, and your colleagues. Rise up for your doctors, because they are the spine of the nation right now. Rise up for your civil staff. They're on the roads working for you. Only the collective and synchronized approach of the complete manufacturing industry can bring us out of this crisis. This contribution of yours to protect the healthcare industry and civil staff will be equal as a soldier who's protecting us at border. The fight against COVID is expected to continue for another 3 months, and the only hope India has is his doctors and the civil workers. Let them not suffer with this crunch of protective gears. Imagine how unsafe they would feel when they do not have proper N95 available, or they continue to use it for days together, 2 or 3 days, since they are to be disposed after every 8 to 10 hours. Let them not suffer like this. The soon we start this campaign, the soon we start this production, lesser COVID will claim life. Long live our workers, our civil workers, long live our doctors, so that long lives India. Jai Hind.